Hi there. So for this part of our lesson, we are all going to practice with our models putting on the male and female condoms. So the first thing you want to do when you're going to use a condom is to examine the condom to make sure there aren't any tears or perforations in the packaging, and to check for the expiration date and to ensure that the condom has not expired. Do not use an expired condom. Don't use a sharp object or your teeth or a knife to open the packages because you run the risk of tearing the condom. So it's also important to use lubrication when you're using condoms. It just makes everything a little nicer. So first we're going to rip the female condom package and pull it out. You'll notice that there are two rings. The outer ring is larger and has an opening. You can see it's open there. And the lower ring is encased in the latex material. This lower ring is what we are going to insert into the vagina. It's important to find a comfortable position. That can be lying down or standing with one leg up on a chair. However you're most comfortable, the inner ring needs to be compressed and held together and inserted. Open the labia and insert the inner ring into the vagina. If it slips out, just start again. Once it's in the vagina, you want to use a finger to push it underneath the pubic bone, which you can see here. It's not really holding it, but this is just a model. You might be curious about all this stuff hanging out. Well, that's normal. And there won't be as much stuff hanging out of a real vagina, but it is very important for this material that's on the outside to remain outside of the vagina. So when you're when insertion is happening, you need to hold the ring securely. And you and your partner will get used to this. At first it may seem awkward, but it will become second nature with use. And so you hold the ring as the penis is going in so that you can see how the condom might want to drag inside, and you don't want that. When you're done with this guy, you can just simply pull it out, wrap it in tissue, and throw it in the trash. And that's the use of the female condom. Okay, now we will use Mr. Dole here to demonstrate the male condom. So for women putting a condom on a man, or for a man putting it on himself, the process is essentially the same. The penis needs to be erect before the condom is applied. Again, no teeth, but we're just gonna tear that package and take a look. One of the things you need to do is examine the condom and figure out which way it's rolling, because if you try to roll it on the wrong way, it's not going to roll down very easily at all. And you have ruined that condom. You cannot reuse it. It's basically contaminated. So you don't want to start over with that condom. You need to start over with a fresh condom. So this is the way our guy is going on, Mr. Dole. And you can see that tip right there is filled with air, and we need it to stay that way. So pinching the tip is helpful in making sure that there's some space left there for the semen. And you just roll your condom on down to the base. You can see we have a little air pocket left there. And here's the ring at the bottom. It's important for the man or the woman to hold on to that ring. It's easier for the man probably when the penis is introduced into the vagina, because you don't want to make sure it slips, or you want to make sure it doesn't slip. There's some banana. Anyway, all right, so after sex, after the man has ejaculated, it's time to remove the condom, and it's easier to do it when the penis is still erect. It's good to withdraw the penis while it's still erect, and then remove the condom, slowly rolling up the shaft, just like you put it on. Remember that there's semen inside of the condom now, and so you want to do this away from your vagina. Get that vagina out of there. Anyway, off this comes. Boom. And you do not want to flush this down the toilet or put it in the sink. It needs to be wrapped in tissue and thrown in the garbage. There you have it. So now everybody has practiced and you're all expert at condom application.